Mr. Tarantino, you may proceed.
Thank you, Madam Chairwoman, Ranking Member Michaud, members of the committee. On behalf of Iraq and Afghanistan Veterans of America's 200,000 member veterans and supporters, I want to thank you for inviting me to speak on this pressing issue facing veterans and their families, and that's the staggering high rate of suicide, not just amongst veterans, but service members as well. My name is Tom Tarantino, and I am the Senior Legislative Associate for IAVA. I proudly served in the Army for 10 years, beginning my career as an enlisted reservist and ending as an active duty cavalry officer. Throughout these 10 years, my single most important duty was to take care of other soldiers. And in the military, they teach us to have each other's back, both on the battlefield and off. Although my uniform is now a suit and tie, I've been proud to work with Congress to continue to have the backs of America's veterans and service members. In today's hearing on suicide, it really couldn't have come at a more critical time. The Defense Department recently reported that 468 active duty and reserve soldiers, sailors, airmen, and Marines committed suicide in 2010. Overall, the DoD tracked 863 suicide attempts, and the rate for veterans is likely much higher. And although we have this limited data about service members, there remains a fundamental gap when it comes to understanding veteran suicide. One of the greatest challenges in understanding and preventing veteran suicide is this lack of full data. If we don't know the entirety of the problem, how could we ever hope to solve it? Even in this age of information and technology, we have no way of tracking veterans unless they interact with some social service that happens to ask about their military service. Frankly, this is unacceptable. To address this problem, we have to look a little bit outside the box. IAVA recommends that we need to collect this data, and we should do it by expanding existing services like the Center for Disease Control and Prevention's National Violent Death Reporting System. Currently, the CDC collects data on all manner of violent death, including suicide, in 16 states. Veteran status can be reported to the CDC either through the death certificate or by information collected by the medical examiner. If we expand this database to all 50 states and require medical examiners to report veteran status in the CDC, then we can get a much clearer picture of the problem and know where to better target our limited resources. The critical step to understanding how we can stop veteran and service member suicides is to understand that suicide itself is not the whole issue. Suicide is the tragic conclusion of the failure to address a spectrum of challenges that veterans face. These challenges are not just mental health injuries. They include challenges finding employment, reintegrating into family and community life, dealing with health care and benefits bureaucracies that, frankly, are almost as traumatic as the injuries themselves. Fighting suicide is not just about preventing the act of suicide. It's about providing a soft and productive landing for veterans when they return home. And the problems with mental health care in the VA system have been pretty well documented. The VA reports that 18 veterans in their care commit suicide every day, and wait times for mental health care, as Commander Campos mentioned, are still unacceptably high, and there's just not enough mental health care providers to meet the need. We also know that many veterans may not be seeking care because of the stigma attached to mental health injuries. Multiple studies confirm that veterans are concerned about seeking care because it could impact their career both in and out of the military. To combat this, IAVA recommends that the VA and the DoD partner with experts in the private and nonprofit community to fund a robust, aggressive outreach campaign. This campaign needs to focus on directing veterans to services such as the Veterans Centers, as well as local, community-based, and state-based services. It should be integrated into local campaigns, such as San Francisco's new Veterans 311 campaign for their city. This campaign needs to be well-funded and reflect the best practices and expertises of both the mental health and the advertising fields. It drives me nuts every time the VA asks me, how do you reach out to veterans? I tell them, stop reaching out to veterans, reach out to people, and why are you asking me? Go ask the people who know how to sell toothpaste. They can put your campaign in front of 40 million eyeballs. Me, not so much. Providing a smoother transition from the military to the civilian world, it's critical in preventing veteran suicide. Ensuring veterans' access to mental health care is connected to other issues that can contribute to a veteran's sense of stability throughout their transition home. We must tackle the other contributing factors such as employment and homelessness that could increase the risk of veterans who are vulnerable to suicide. The responsibility of building a support network doesn't necessarily lie with the military and the veterans' families alone. Preventing veteran suicide is about easing the transition from military to civilian life, and it's our collective responsibility as a community. Our veterans are not just readjusting to their families or connecting with other veterans, they're coming back to jobs. They're using their GI Bill to go to school and study at local colleges, and they're seeking care and services from businesses and providers across the community and outside of the Veterans Network. We must focus on extending this understanding not just to spouses, but also to society at large. Teachers and professors should know what students of theirs are veterans or the children of veterans and service members. Businesses should invest in the leadership of returning veterans by hiring them. Healthcare providers must understand the injuries facing these incredible men and women. By promoting awareness, we can ensure that our entire community is able to support veterans throughout their transition back to civilian life and help stem the tide of veteran suicide. By accurately measuring the problem, by improving access to mental health care, and tackling the transition from military to civilian life and creating a robust community of support, we may be able to significantly reduce the number of veterans that attempt to commit suicide every year. Veteran suicide does not have a silver bullet solution. No one bill is going to solve this problem. But better practices are out there, and we don't want to have to ask ourselves if there was something more we could have done. Thank you very much for your time and attention. I'll be glad to take your questions.
And thank you, Mr. Tarantino. What's the one thing we need to focus on? I'd like to hear if you could just tailor your remarks so all four of you get the opportunity to respond. I would appreciate it. Thank you. Mr. Tarantino?
I know this is going to kind of sound lame, but outreach and awareness. I mean, bottom line, the VA has good programs. It has the crisis line. It has the new Making Connections program, which I think is pretty slick and pretty cool. The problem is nobody knows what the VA does. Nobody barely even knows the VA exists. If you go outside and pull 100 people off the street, ask them what NASA does, I guarantee you're going to get 90 of them going to give you a pretty decent answer. And NASA affects a fraction of a percent of the population directly in this country. 6% of the population would be directly affected by the VA. You'd be lucky if maybe 10 out of those 100 would be able to tell you what the VA does and what programs they have. It's because as a community, we're so insular. We're insular to the veterans community, the military community. As the veterans population is dynamically shrinking, we have to stop that, and we have to change the way we think about outreach to veterans. And we have to reach out to families, to the community. Why? There's not that many of us in my generation of veterans, and guess what? I'm a soldier, I'm also kind of a knucklehead. I'm not the one who's going to go out and seek help. It's going to be my girlfriend, my mom, my best friend. Those are the people you have to reach out to, and that's where we need to focus our efforts to stem the tide of this.
Thank you.
Tom, you had mentioned about getting information out. Yesterday we had, I don't know whether you know Jim Young or not, but Google has, you probably do, Google has 2 people assigned, DOD assigned, to help in their Google search engine to get information out, which is how a lot of young people are treated in theater, for instance. Many of them are in isolated places, and they use telehealth. And a lot of our younger soldiers, not like me, I mean, I couldn't do that, but they enjoy, or it's easier for them because of the stigma of PTSD. They much prefer that, and in some instances that works very well. I think that could work here, stateside, very well, where you have overly burdened VAs. So that's one thing. I know there's an organization we also went to this week, Not Alone. I'm sure you're aware of them too. They're in 20-something states now, who on their own outside the VA are another resource for veterans to reach to if they know that they are there. So I think this new a way to approach people with this right here. Anyway, I mean, everybody's got a cell phone now just about in this country. And that's one way we could communicate better, I think. And, Tom, if you would, I was intrigued by the 311 campaign. What are they doing there?
Well, as you know, many cities have a 311 campaign. It allows you to access all manner of city services. I think New York has one. I think Houston has one. Chicago, and in San Francisco, we were contacted by the former mayor and asked, we have a lot of veterans in San Francisco. We have a lot of veteran services, but we need a way to get our citizens to these services. And so we work with them to develop a campaign where when you call 311, if you're a veteran, you press, I can't remember what the exact number is, 1 or 2, and you get sent on a separate track, meaning you have a shorter queue, you get sent to a separate track of veteran services, you have unique access, and that works not just on the phone, but it works online as well. And I know coming from the Bay Area myself and from the state of California, they actually do this with all their social services. If you're a vet, there's a separate line, there's a separate track that you go through, and the services are more tailored to you. And the idea of integrating national and VA services with that is that, look, the VA has the power to be omnipresent. They have the power to set minimum standards for care and services, but it doesn't mean that we can't use the multiple touch points and interactions that are actually happening in communities that we don't know about because we're not tracking it. And I'm not talking about contracting, we're just talking about partnerships for care. And I think by developing that type of model where city services and state services have some sort of integration or at least have some sort of crosstalk and communication with VA services, then you can actually catch a lot more people before they get to that tragic conclusion of suicide.